Assalamu alaikum. Welcome to the North American Muslim Foundation Senior Talk Show. On our show today, we have a business professional, Iftikhar Ejazi. Iftikhar, thank you so much for joining us on this talk show.
You're welcome. Walaikum assalam wa rahmatullahi wa barakatuh.
How are you doing today?
I'm doing great. Thank you very much.
Wonderful. Iftikhar, this talk show is all about individuals and seniors. And we are trying to find the gaps in the services and how we can improvise or how we can advise to improvise services within Ontario. We always start off with your immigration to Canada. So would you like to share some light on your immigration to Canada?
Yeah, it so happened that the rest of my family, my siblings and my parents were already in Canada and in the United States. Mm-hmm. My younger brother, myself and my parents were in Canada.
Okay.
And that's what brought me to Canada. Mm-hmm. And my older brother and my younger sister, they are in United States in Florida. Mm-hmm. I was the only person out from the family who was not in this part of the world. So they told me, they forced me to come here, and that's what brought me here. Mm-hmm. I was doing pretty well in my professional career in the Middle East and in India. But your siblings, your parents are more important than the rest of the things. That's what brought me here.
Agree. Parents and siblings are most important, and once you are successful in your own career, you try to find your way no matter where you are.
Absolutely.
Coming to our next question, Iftikhar, I know that you have an ailing mom and you take good care of her. We would like to find out what are the services that she is receiving from the government and what are the gaps that you noticed for the services.
See, for ailing seniors, I'll rather put it for all the seniors, not only my mom.
Exactly.
I've gone through the whole process. It is very important that the approach to the government should be made much easier. Right now, it's very difficult to approach the government. You call the numbers, you go unattended, and then one person will transfer you to the other person. You keep trying. It takes a lot of your time and efforts. Some people may break down doing the process. Some people may try to reach. I was fortunate that I kept on persistently trying it, and I got it. Now, when you get that, there are a lot of things, especially seniors, because they have no income. They are only on pension.
Yeah.
Now, their pension is limited. Cost of living has gone up tremendously. Mm-hmm. Like in my mom's case, the rental itself is almost about $8,900. Yeah. Her entire pension goes in there.
Yes.
She doesn't have anything left for her meals, for her other day-to-day activity which she needs to be taken care of. Mm-hmm. Unfortunately, the government does not, even all three levels of government, they should integrate. They should not say it's a city matter, it's a provincial matter, it's a federal matter. At any level, the representatives must ensure that they take initiative and they follow it up, their office follow it up on behalf of the residents of Toronto or in Ontario or anywhere in Canada for that matter. They have 1 year period of supplies if committed, or they also take into account the money which the seniors may have in their account. Now, mostly what people do, they try to keep some money safe for the final rights.
Yes.
Which, unfortunately, I explained it to the government at different levels, at the Toronto Hardship, the social welfare department. That this money, we have kept it aside. We are spending money from our pockets. Our incomes are limited, and I am also landing up in debts. They don't understand. They say it's an asset in her account, which has to go. They have to rationalize. They have to understand that if some money is kept for the final rights, it should be considered as a final rights money.
That's a valid point that you raise, because you see, in our culture, it's our pride, it's our dignity to spend our own money for our final rights. We all do that. But considering that as an asset and not providing sufficient funds for the senior is a bit difficult. I know, it's not easy.
It is tough. And even in supplies, I was fortunate, I must call it. I did get a hospital bed for my mother. I did get a Hoyer lift for my mother. I did get a wheelchair for my mother.
So how did you get that? Did you get it through the hospital, or did you get it through a recommendation of a social worker?
No, I had to approach social worker. Incidentally, the place we have moved to because of accessibility to services is in Scarborough. And the person who represents my consular seat is the deputy mayor. I called his office several times. I did not get a call back even once. The MPP did respond to my calls, and she guided me out on a number of occasions. Her office also gave me the contact for Toronto Hardship. Toronto Hardship was very difficult to reach the right person.
So what services does Toronto Hardship serve the community with?
Toronto Hardship basically gets into action where the seniors or people who are in real difficulties, like you don't have an employment, you don't have an income and stuff like that, and you need to survive. There's certain support which has been given to them.
Okay.
Based on that, only my mother got these things because she doesn't have money.
Yeah.
And all her day-to-day expenses was being met out of my own personal income, which was tough on me too.
How old is she, if you don't mind me
She's
asking?
91 years old now.
She's 91. So does the pension, say from 65 years to 91 or 92, does the pension stay the same?
It increases with the increase
Bare
in
minimum?
It's bare minimum.
Yeah.
And considering the cost of living.
Yes.
See, the cost of living, what you had about 20 years before is not the same today.
No.
But the increase in the amount of pension is peanuts.
Yeah, because it doesn't balance, because this is what I heard with a lot of seniors. They say when, we become seniors, then our pension versus the cost of living, it's not equal.
It's impossible to match.
Yeah, it's important.
Which the government needs to look at it at the federal level, at the provincial level, even at the city level.
Yeah, that's very well said. Yes, yes. Especially these days, because even though more after COVID. So coming back to this question, I wanted to find out, during COVID, how did you manage with your mom, and did you find any shortage of services at that time?
During COVID, it was a difficult time to go through. We were getting some support in terms of PSW supplies from through the LIN Local Health Integration Network. But the agency which was sending, I'm trying to put this forward, which the government should hear and audit such things.
Yes.
The PSWs who come there, ideally they are trained on everything, including the various type of lifts, because before they get certified, they go to a long-term care home.
Care home, yeah.
And there they have to perform all these duties during the placement to get certified. Most of them will come with no information. They will raise their hands, I don't know this, I don't know that, or they don't spend the entire hour which is given to them. They will spend 5 minutes, they'll touch the diaper and say it's dry and I'm leaving. I kept on calling the agency, I kept on calling the LIN and the GAIN, the different agencies of the government, to tell them that they must have a check-in and check-out system where their time is recorded accordingly.
Yes, yes, a timesheet where you could probably submit that to them.
They have to call.
Okay.
It's simple. Like they have to call their presence.
Yeah.
When you clock in, you clock out.
Yes.
But they have not been able to listen to me at all. And time and again, I have been raising this issue. Some PSWs are good. Some are really difficult to handle. They restrain the patients. My mother used to. I can share some videos at some point in time where my mothers will be crying like crazy. They will put a restraint on the hand, and my mother will have dark patches all over. And they will just deny that it's not that. But then I started recording. And if you see her screaming, your heart will go out.
They have to be handled with care. They have to be handled with care. They can't be so harsh to them.
Unable to speak,
Yes.
to express what's going on, unable to walk, and that's not the way. Agency does not take care. They just don't. We have been almost 1 year, we have been asking them to give us a schedule as to who is scheduled at what time to come in service, because at the end of the day, I have to do. Now I'm on a part-time job.
Of course.
Because I can't afford a full-time job because of my mother's commitment. Now, I don't know what time the PSWs are coming. They come on their own time.
Oh, that's not good. Oh.
Another very important thing I like to bring up, like at 91 or even at 70 or something, once you become a senior, you don't expect a senior to go out to get your blood work done.
Yeah.
And especially at this age, during COVID period.
Yeah.
My mom did get twice the blood work done at home. Then I called Lynn for the current one. She said no. Then she had a OT coming home, so she was on some service, so she got that free. Then she had another physiotherapist coming in for 6 days.
Yeah.
In the entire period of 1 year, only 6 days.
Okay.
So that's how she got it done. But now it has to be paid. How do you expect a senior to go and pay for such services?
It's expensive.
And at the same time, how do you expect the senior to go out to a lab and get the blood work done?
No, that's impossible. Makes no sense.
I was advised.
Yeah.
I was advised by Lynn, whoever is the care coordinator there. I won't like to name, that you should talk to your MPP and take this issue up. And this is something.
No, Lynn is a pretty good organization who takes care of seniors, so they have to implement something.
And say this at this age, it's not possible.
Yeah.
Now, this service has to be provided to the seniors. Blood work has to be done at home. You have to send something. They can't pay for it.
See, this is the support that we need to render to you, because you need to make an income as well.
Absolutely.
So imagine you need to survive too. Now you can't be a PSW for your mom.
No.
You want to go out, you want to survive, you want to make a living for yourself. So there has to be a way. Now these are basically the gaps in the services that have to be rectified, and they have to make sure that, the seniors, and I'm sure it's not only your mom, there might be so many other seniors around.
I'm talking generally for the seniors. And since I have experienced what I'm going through, I'd like to share this. So a proper action is taken, government looks at it and comes out with a program which actually helps us, not on papers, not on talks. It should be in actual reality.
Yeah, and the patient has to be satisfied with the type of service that they're doing, because 92-year-old, I did hear from other people too who had ailing mothers or mother-in-laws in their houses. They did have this concern. They said some of the PSWs are really polite and really nice, and some of them aren't. And the senior who likes the polite PSW would always recommend, I would like to have her.
Always the case. See, the difference is now we have a couple of good PSWs.
Yes.
She never screams.
Yeah.
They know how to handle a dementia patient who cannot express, who cannot walk, a person who is completely motionless, in other terms.
Yeah.
They handle them because she doesn't scream.
All they have to do is be polite.
Why was she screaming earlier? Because she was being restrained for all purposes.
Yeah.
And they weren't given the entire time. These PSWs are supposed to get a care plan from the agency as to what is to be done.
Yes.
And
I'm sure they must have, explained all of that during the training period.
Oh, sure.
Apart from that, there have to be some follow-up sessions when there's a complaint from, a client. They have to make sure that they follow up on that complaint.
Absolutely.
Because
see, I can tell you more on it because of my mother's situation. I enrolled myself in a PSW course.
Amazing.
I've completed my college. I'm in the placement right now, which is going to get over very shortly. Just to understand, and I see how the training at placement, which is a practical training, goes on. It's rigorous. It teaches you everything what is required to be a good PSW.
Exactly.
What surprises me, why most of the people do not follow that. There should be a government audit on this, and people who do not follow this, or for people who get complaints from clients, they should be given a coaching or a training again.
Yes. Now, these are valid, suggestions that you're laying down, and that was another reason for us to invite you to the show, because for a long time I've been seeing that you were taking care of your mom, and the feedback that we receive from you is so valuable. I hope something good comes out of this interview when they listen to your concerns.
Sue, I'll also point out some very minute things. There should be a system where the primary caregiver, who could be a family member, should be compensated for the time so that the person is at ease to take care of the patient at home.
I think there is a program. You'll have to contact with the MPPNC, because I did hear about this, that if the wife is taking care of the husband, then something, she is compensated for that. So try to check that out. And now that you are a PSW professional, a trained PSW, I think they should be able to do something for that. You can find out. Check that out with the MPP office. And I know MPP officers are very helpful, so take your concerns to them, and they should do something.
My MPP, Christina, she is good.
Yeah.
She responds to
Wonderful.
Her office is also very good. They respond immediately. The moment you send an email or leave a voice message, they'll call you back or send you an email.
Yeah, keep them as your first contact, because locally they are the people who help us much more.
My city councillor is useless.
So maybe that has to be within their scope of practice. Not sure if it is not under their scope of practice.
No, it is. It is basically it's a Toronto hardship, so it's a city matter.
Yes.
It is, even if it is not, you're my representative, you're my public representative.
Yes, you have to stand. They have to stand for you.
with me.
Yeah, they have to, and especially during these tiring hours where you are taking care of your ailing mom, and she is 91, 92. And the best part is you are not, leaving your mom in a care there outside, where it's more expensive for the government.
Yes.
You are taking care of her at home.
At home.
So you are saving some sort of a finance for the government and taking care of your mom on your own, and she is aging and would love to stay with you. You love to stay with her till the last minute. You're serving her. So something has to be done about that, and keep pushing. That's all we can say.
I would also like to point one more thing, like when the seniors come, and what I have noticed when I'm going for my placement into the long-term care, is seniors have different food choices.
Yes.
One is they don't eat solid food. Most of them will be eating purees.
Yeah.
Now, making that puree itself is very expensive.
Yeah.
Two, many of them give up drinking water.
Yeah.
So liquid has to go into the system. Now you go and buy Pedialyte for them. One bottle of Pedialyte, which is less than a liter or about a liter, costs you about $14 in Shoppers Drug.
It is expensive.
It is expensive. Sometimes they won't have that puree because they don't like the taste. So to supplement that, you have to give them Ensure. Now Ensure is very expensive again.
Yes.
Now,
so did you contact?
I sent it to the city, and the hardship, they said no, this is not covered.
Did you contact a dietitian? Maybe when you contact a dietitian for that, dietitians do have some sort of a plan to help them, a diet plan to help the seniors.
Okay.
Try to contact the dietitian, try to contact the social worker and see what they can do to help you.
I'll try.
Because there should be a program especially for the special diet.
Dietitian will go through Lynn, or it will be a direct
You can go directly, you can do a self-referral for your mom.
Okay.
Yeah, there is a special diet plan through the dietitians which might be of some help to you.
My doctor, her family doctor has written all those things.
Not necessary. You can, even if she has written, it's well and good. And then you can have a direct appointment with the dietitian and let her know about this. At least they should be able to provide these liquids to the
basic
senior.
Liquids which is required for the senior patient.
Very well said, very well said. It's important that we take care of our seniors. They have spent their entire life here. They have paid their taxes, and people like you have paid the taxes, and you have been working so hard all your life. So this should not be a stress on you. We should be of great help to you so that you can take care of your mom and she can age, respectfully in the house.
It should become much easier to approach. It should not be a complex, difficult system. Calling one phone to another phone, always goes on an answering machine, nobody to take your call. Next time you call, there's some other agent on the phone. You have to explain the whole history again. Then again and again.
Yeah, there's a new person. Every time there's a new person on the phone.
So
I agree with you.
Happen. Yes. It should be recorded, even if there's a new person. It should be there on the system.
On the system.
It's gone through.
Yes. No, I agree with you. Thank you so much, Iftikhar, for coming today and enlightening us with all the issues and the gaps in the services that need to be addressed for the seniors. And we hope that, your life becomes easy, your mom's life becomes easy, and we wish you all the best with your services, providing not only to your mom, but as a senior, as a Canadian senior.
Past, yes, I would like to help the seniors. That's why I did a course where I can be of some use to seniors.
We will keep you connected with all the other seniors in the community. Thank you so much for coming here.
I'm really grateful to you for having me today.
Thank you.
Thank you very much.
So once again, seniors, this was our episode with Iftikhar Ejazi. We hope you enjoyed this episode as well, full of information for seniors. So stay tuned for our next episode. Sajida Khan, your host on North American Muslim Foundation's senior talk show, funded by the New Horizons for Seniors. Thank you.